When I was about 18, just across the lake in the University Medical Centre, by a very friendly GP who was very old and said I should be grateful not to have periods because from what he'd heard they were a bit of a nuisance. It has moved on in, well, two key ways for me. One, GPs are not perceived to be the sort of geniuses that our parents assumed they were, and they're much more willing to discuss conditions. And I certainly found my lucky break came when I stumbled on a locum here at Aston who referred me. She was a lady doctor and she referred me, and from that point on I realised with her help that GPs can't be expected to know everything about everything. Subsequently I've kind of gone out of my way when I've met a new GP to say, this is me, this is my condition, anything you want to know about it, ask me. Which is a little bit cheeky, but I have found has been appreciated along the line by GPs who are far more willing these days to say, oh, that's interesting, tell me about your experience. Well, I think, I don't know, I mean, when I kind of imagine how much of my knowledge could potentially be taken up with PCOS, and then I multiply that by the thousands of conditions that exist, you start to understand why GPs can't possibly be expected to know everything about everything. So I think probably most of them are aware. And then the structures are such that once you're referred to a consultant, most of us don't then go back to our GPs and say, oh, I went to the consultant and this is what he said. Most of us are sort of, we're channeled away from that, aren't we? And we don't go back and say, this is what happened. And the GPs don't often, I mean, they get informed, don't they? But they can't be expected, I don't think, to absorb every single little thing that happens to every single little patient. So I suppose what I'm saying is that I've learnt not to expect my GP to know. I expect to have to explain to him where I am in my journey and explain to him what help I need at that stage. And I've found my GP currently to be more than willing to operate on that basis. At the time, absolutely clueless, and it was, I just kind of mumbled along really, not that bothered really, having very irregular periods and all the things that involves, but kind of accepting my lot really, until absolute chance I had, it was a kidney infection and I had to go into hospital, and a nurse absolutely off the top of her head said, they asked about medical conditions and I said I had polycystic ovary syndromes, and she said, oh, so you won't be able to have children? Completely off the top of her head, completely out of nowhere. And I thought, oh God, oh, well actually maybe this is more serious than and it had never dawned on me, and nobody had ever said that was something that I needed to think about really. And I think then I was probably about 23, 24, something like that. So okay, you see, I must just be a really pushy patient, I think, because at that point I went back to my doctor and said, I didn't realise how serious this was. I want to talk to an expert. And they referred me to the Women's Hospital in Birmingham, where I got a formal PCOS diagnosis at that point. I had a scan and whatever. But in those days, there were no treatments, really. It was still very much, yes, this is going to be an issue, but there's nothing we can do about it. Stay on the pill, you'll be fine. But I think I decided at that point that I was going to try and keep up to date, really. So I just kept going back. Every 6 months, I kept going back to the doctor and saying, I've got polycystic ovary syndrome. Last time I saw you, there was nothing you could do about it. Has anything changed? And eventually, the GP said, oh, actually, I think there's this drug called metformin. It's being trialled in America. It's illegal here, but go and talk to the consultant, see what she says. So I went to see Miss Payne at Birmingham. And she was all for me going on it, and I was probably one of the very first, I'll say the very first, probably amongst the earliest patients to be put on metformin here. at a time when you had to beg your GP because it was very dubious. And I remember going to the GP with a load of research notes that the consultant had given me and said, right, this is the drug she wants you to put me on, and this is what she thinks you should read in order to persuade you to let me try it. And that must have been probably 20 years ago, something like that. So I've been on metformin off and on for about 20 years. It's made a difference because you feel like you're being treated. You feel like you're getting something because previous to that, it was, yes, you have irregular periods. That's no big deal. Don't worry about it. So you feel as though you're getting something. I find it relatively easy to tolerate. The biggest problem I have with it is that there are so many different brands of metformin on the market. So every time I go to the chemist, she gives me a different brand, and every time I get a different brand, the symptoms come back. So that's really hard. So a top tip for metformin use from me would be speak to your pharmacist and make sure you get the same brand of tablets every time, because I find if I get the same brand, after a couple of weeks I can tolerate it quite well. Whether it's helped me lose weight, I don't know. I mean, I have lost weight on metformin and I have lost weight not on metformin. But it seems over the years to have become a fairly standardly prescribed support. And I think I'm of a mind to accept that support in the absence of any clinical evidence, particularly one way or another at the moment. The thing I've found most useful about Verity more recently are the discussion boards, because I'm having fertility treatment at the moment, and although I have a sister-in-law who's had fertility treatment, she didn't have it with PCOS, and the only place I've been able to make contact with people who are doing what I'm doing against the background of having PCOS is on Verity, and I've been absolutely stunned at how many of us there are. Absolutely stunned at how different our experiences are, because we discussed at conference earlier about how when you initially get offered some sort of treatment, you think, oh, brilliant, excellent, it'll be fixed. Well, fertility treatment with PCOS is the most bizarre roller coaster you can imagine. They give you the drugs, they tell you what the drugs are supposed to do, and then they say, but you've got PCOS. So sure enough, my ovaries, who've done absolutely nothing for the last 30 years, are currently hyperstimulated, which is the most unexpected scenario of all. But the nurses at the centre are going, oh yes, but you've got PCOS. So you kind of get used to that. But it's really helpful to be able to then go home and say, where is the one other person that's got this combination? And she will pop up and she'll say, no, it's not just you, it happened to me as well. And that helps a lot. I faced it that day in casualty when that nurse said to me, you've got PCOS, you'll never have children. And that's a long time ago for me. It's a very difficult question. To put it in context, I'm 40. When I was faced with that question, I was in my 20s, and there was no treatment for PCOS. You weren't routinely referred for fertility treatment. So at the age of about 20, I was faced with that as a fact, more or less, by the medical profession. I have no idea whether in reality it was a fact, but it was presented to me as a fact that I had to come to terms with. So I came to terms with it very early on. So consequently, I'm a fantastic auntie, because I knew what was going to happen. And then suddenly, at the age of about 40, with a new partner in tow, I suddenly became aware that medical science had moved on. So for me personally, the hardest thing was actually coming to terms with the possibility that I might, because I'd spent most of my years as a woman coming to terms with the fact that I wouldn't, and then because the medical science moved on as I was growing up, it's kind of turned tables on me. So I'm at a stage now where I'm undergoing fertility treatment, which 20 years of my life tells me won't work, but the last sort of 5-10 years of research in medicine tells me might. So, I mean, my friends, I think I'm a bit odd, because I'm going into it assuming that it won't work. Which is really strange, but I'm going into it because in 20 years' time, if I look back and think, right, I had PCOS and I let it get the better of me, my chance came and I didn't take it, that would be unbearable. Whereas if I look back and think, right, okay, I had PCOS, my chance came, I took it, it didn't work, I think that might be easier to live with.